Welcome back to the OHSU Effect Inside Health and Science at OHSU. I'm Lacey Evans. We're going to talk now about treating patients with something called telemedicine. Imagine being able to talk to your doctor bedside, even if he is at a different hospital, or being diagnosed via video conference, or being treated by a specialist in Portland while you're still at home in McMinnville, or even Ontario in Eastern Oregon. With me now to explain all this is Dr. Wayne Clark from the OHSU Stroke Center and Dr. Miles Ellenby, who works at the Pediatric ICU at Dornbecker Children's Hospital, and he's also the medical director of the Telemedicine program. Good morning.
Good morning.
Okay, Dr. Ellenby, let's start with you. Why don't you tell us what telemedicine is?
Thanks, and thank you for the opportunity to speak with you all. Telemedicine, quite simply, is using video conferencing technology to provide care for patients at distance. Improving access to care in areas where you wouldn't otherwise be able to see a specialist in a timely fashion. And it's really nothing more than using video conferencing equipment, which has been used for decades in the business world, to see patients in community hospital ERs.
So you're connecting people from all over the state, is that right?
Essentially, we have connections around the state. It's we have to sign up the hospitals one by one, so it's not offered everywhere around the state at this point in time. But we have connections from Eastern Oregon down to Coos Bay and up to Astoria. So, yeah, all around the state.
So how did the OHSU Telemedicine Network start?
It started about 4.5 years ago with our friends down at Sacred Heart Medical Center in Eugene, who were looking to increase their ability for them to care for a sicker pediatric patient. One of the things that we've known for a long time is that a lot of patients get transported up to Portland for unnecessary reasons. In Oregon, there's a limited access to specialty care around the state, especially in the world of pediatrics, neurology, where almost all the specialists are localized in the big metropolitan centers, and especially in Portland. So a large amount of patients are transported up to Portland for care in emergent situations. One of the things that we've known for a long time is that a number of these patients don't need to come, and it's a big expense. It can be a dangerous transport. And finally, it's really disrupting for the family when they need to come unnecessarily. The telemedicine piece allows us to do a better job of triaging these patients on the front end, make better decisions.
Do you do telemedicine over the phone?
Well, the old way of doing business was using the phone only, and it's really a limited data set that you get when you're communicating with a physician over the phone. So not only are we dependent on the physician on site to do the proper assessment, which they're often very good at doing, but then also communicating that to us over the phone, which is a skill. Now, instead of depending on that, we have a camera on site that we can move around from Portland and zoom in and see what's really happening. It can make all the difference in the world in making these decisions.
Well, Dr. Clark, I want to ask you, how is the Telemedicine Network providing care for stroke patients?
Thanks. Well, stroke is a condition caused by a blockage of blood flow to the brain. It's a devastating disease for both patients and families. The good news is there's some treatments that are now available. The bad news is these treatments have to be given in the first couple hours, and they do have a risk. So you really need to know which patients should receive these treatments. Many hospitals do not have stroke specialists or a neurologist available. And so it's a tough decision for the emergency room physician on whether they should treat the patient. Is this really a stroke? And this is where telemedicine can come in. By making house calls via the video and the screen, we can have a specialist there with the ER doc, with the patient there immediately.
And I understand that stroke is of particular concern in our region, right?
That's correct. Unfortunately, up to 8,000 patients a year in Oregon have strokes. Many of these, as I mentioned, are not near major centers and will be at a small hospital. So in order to get these appropriate therapies to them, we're using telemedicine to extend the network of specialists.
What other areas is the OHSU Telemedicine Network used in besides stroke and ER situations?
Well, again, in addition to stroke, we have a large experience with pediatric as well as with the neonatal, the real little ones. We're also a long-term experience with psychiatry and starting some programs with trauma and neurosurgery.
How do patients react to this? Dr. Ellenby, I'll ask you, are they okay with talking to a video screen?
Actually, they're more than okay. That was one of the initial concerns, that people would feel this would be depersonalizing of the interaction. There was also concern that the physicians would be kind of looking over the shoulders of the ER docs at these community hospitals, when in fact the reverse is true. Families are very happy to receive care in this way, and the doctors out in the community are very much desiring and happy to get the input of the specialists up in OHSU to help them with the care for these patients. And it's turned out to be a great partnership between us and these community hospitals.
And what about families? I'm sure this is connecting families as well.
Yeah, that's actually one of the things that we didn't fully anticipate when we started the program but repeatedly we hear from the parents of the sick children of how valuable it's been, even when they are transported, to be able to see where they're going. That visual gives them a lot more comfort. And so instead of, you can imagine, loading in the back of an ambulance in the middle of the night with your sick child, having no idea where you're going, when you have a visual, it really kind of decreases a little bit that stress that they have going into the situation. And again, finally, in some circumstances, it's different for each center what they can do, but some of these children can stay in their community, continue their care safely.
Let's talk about the telemedicine services that they'll be providing in the future. Dr. Ellenby?
Well, what we're doing in acute care medicine is just the tip of the iceberg of what's possible in telemedicine. We are now exploring and starting some pilots in outpatient medicine, especially around the diabetes care. And here the concept is, for example, say you have a child, you live in Medford, Oregon, that has diabetes. They need to see an endocrinologist every 3 or 6 months for what turns out to be about a 20 or 30-minute appointment. In order to achieve that right now, you have to drive 5 hours one way, miss a day or two of work, school, huge expense for these families for what could be a 20 or 30-minute appointment. That could easily be done over video conferencing. So a lot of these folks don't even get the care that they should get because of that expense. Now they can get it in a seamless fashion.
Yeah, I was thinking it would save the doctors a lot of time, but it sounds really like it's saving the families and the patients a lot of time.
Both ways, because we also have a large number of outreach clinics where our physicians are driving out to these communities to perform clinics. And again, those are not always the most efficient uses of time. We're not trying to eliminate those outreach clinics, but make them more efficient. And there's some circumstances where it can be done over video conferencing, both to the benefit of the patient and the physician as far as a time standpoint.
Well, Dr. Clark, what role does the telemedicine network have in healthcare reform?
Well, again, as we kind of already discussed, it really could save a lot of the transport costs. Some acute stroke treatment, for instance, can be delivered there and now in the local hospital, so the patient doesn't have to go 100 miles to a major center. With helicopter transport up to $20,000 a case, that could save a lot of money right there. In addition, by treating patients early, we can improve their outcome. So that also will decrease long-term nursing home costs, rehab costs, and whatnot. So I think by getting there early and many times allowing the patient to stay there, we can cut costs.
And another piece I'd like to add is one of the big motivators in the healthcare reform bill is to decrease hospital readmissions. And one of the legs of telemedicine is a concept of Inplace monitoring, where when we send these folks home, we can send them home with some monitoring equipment that will automatically upload their physiologic data, whether it's their weight or their blood pressure or their glucose levels, automatically upload those to the physician's office so the physician can get that data in real time and start helping to treat these folks before they wind up showing up back in the emergency room in our acute care center, and trying to keep those folks at home.
Well, this sounds like a really great and emerging program. So where can listeners get more information?
The university has a website at www.ohsu.edu/telemedicine. And on that site, there's some videos to see how it works, as well as some news articles about some dramatic stories where telemedicine has made a big impact.
Great. Well, gentlemen, I really appreciate you being here. Thank you so much.
Thank you.
Thank you.
Dr. Wayne Clark from the OHSU Stroke Center and Dr. Miles Ellenby in the Pediatric ICU at Dornbecker Children's Hospital, also the medical director of the telemedicine program. If you want more information on the telemedicine program, you can go to ohsueffect.org or ohsuhealth.com/telemedicine. And we have all of these interviews on our website as podcasts in case you missed anything. Lots of great information and resources on kxl.com and ohsueffect.org. Coming up next on the OHSU Effect, Effect, Inside Health and Science. The problem with aging. It's going to happen to all of us, but aging and retiring baby boomers could really put a strain on the health system. Dr. Henrique Urbanski and Dr. Elizabeth Ekstrom will join me to talk about what's being done not only to keep the elderly out of the hospital, but what's being done to train healthcare workers on the effects of aging and getting them ready for the 20% of our population that will soon be older than 65. That's just 5 minutes away on the OHSU Effect, Inside Health and Science on FM News 101 KXL.